Back here in Accra, CDD Research Fellow Kwame Sapon is urging government to prioritize research and data-driven decision-making in the healthcare sector. Speaking at a public lecture organized by JoyNews and various professional bodies on the theme Down Memory Lane 1993 to present, has this democracy delivered a health dividend for Ghanaians? He said the failure of Ghanaians to raise concerns when a new government starts building new health facilities, while previous ones by the past government remain unfinished, is a significant reason for the inefficiencies we witness in our health sector.
The Agenda 111 project includes district hospitals, 6 regional hospitals in newly created regions, 2 specialized hospitals in the middle and northern belts, as well as a regional hospital in the western region and renovation of the Ifyankwanta Regional Hospital. The minority in Parliament in August said government's Agenda 111 project, which was launched 2 years ago, has delayed due to funding challenges. Deputy ranking member on the Health Committee of Parliament, Dr. Market Nawani, said government has not been fair and truthful to Ghanaians, an assertion denied by government. Speaking at the public lecture at the British Council, CDD Fellow and pharmacist Kwame Sapon said failure of Ghanaians to speak up when a government starts the building of new health facilities when previous ones by the past governments remain uncompleted as one of the reasons for the waste we see in our health infrastructural projects.
The truth is our politicians are very good storytellers and sloganeers. They are well aware that investments in health take a while to trickle down as health outcomes. For example, achieving significant improvement in infant mortality rates may take between 5 and 10 years. For life expectancy, it can take around 10 to 20 years. And for maternal mortality rates, it can take between 10 and 15 years. Therefore, they are clear that they cannot claim credit for most of these outcomes over a 4 or even 8-year term. However, if they build a hospital, CHIPS compound, or pay trainee nursing allowances, they could point to these at the next election, whether or not these are value for money investments or misplaced priorities. Being the storytellers they are, they opt for the tangibles and carve these stories around them. Hence, slogans like Agenda 111 have become catchphrases on which votes are procured. But then again, we are partly to blame. Is it not strange that in a country whose constitution speaks of the directive principles of state policy, we find a government commencing building of new health facilities when the previous facilities started by the previous government remain uncompleted? How have we as citizens become so divided and supine that we fail to stand up when things like this happen, knowing very well that the main driver of such schemes is procurement and sometimes sleaze? This is a major contributor to the waste we see in our health infrastructural projects, and perhaps a major contributor to why health inputs yield marginal outcomes. When they try to compare their performance in health, our politicians elect to compare with the performance of their opponents, not with the performance of countries with similar GDP or health expenditure per capita.
He says data and evidence must inform decisions in the health sector.
To achieve this, we must, 1, engage in inclusive conversations. The development of a sustainable health policy should be rooted in conversations that include voices from all levels of society. Inclusivity ensures that the policy framework addresses the diverse needs and challenges faced by different segments of our population. The era when politicians come out with a plan and sell it to us as the solution without understanding what our pain points are must be buried. Our leaders must first listen, think, and then dream. It is only after having a dream should planning commence. 2, prioritize research and data-driven decision-making. The journey towards better health outcomes must be guided by data and evidence. Rigorous analysis of health indicators, comparison with similar nations, and regular assessment of progress are essential for informed decision-making. Embrace long-term vision. While politicians often seek short-term victories, the dividend of a functioning health system manifests over time. Policymakers must adopt a long-term perspective that prioritizes sustainable improvement in health indicators.
Senior lecturer at the Economics Department of the University of Ghana, Priscilla Chumesi Balfour, says health is wealth and income is not a sufficient condition for development.
I'm not surprised that the health outcomes that we see are not great, and at best it appears we have been quite sluggish in the growth whilst others are growing faster in the right direction. Why? Because we know that development is a continuous process, and development which must translate into high incomes for citizens, good education, better health outcomes, and social security for all. It's a continuous process. But when you track the growth trajectory of this country, it has been quite checkered. So there is the need under this democratic dispensation to look at the sources of vulnerability. What happens to the productive sectors of this economy that makes the economy struggles to grow in the right direction, to yield some of these dividends, including healthcare outcomes.
Pharmacist and consultant William Ufori says more has to be done to improve Ghana's health sector.
There are less than 12 neurologists for the 15+ million adults, or 32 million population. There are less than 12. I'm not just talking neurologists. Interventional cardiologists, they are less than 12. Endocrinologists, they are less than 12. Nephrologists, they are less than 12. Medical oncologists, they are less than 12. That is scary.